For adults with Crohn's disease or ulcerative colitis symptoms, every choice matters. Tremfya offers self-injection or intravenous infusion from the start. Tremfya is administered as injections under the skin or infusions through a vein every 4 weeks, followed by injections under the skin every 4 or 8 weeks. If your doctor decides that you can self-inject Tremfya, proper training is required. Tremfya is a prescription medicine used to treat adults with moderately to severely active Crohn's disease and adults with moderately to severely active ulcerative colitis. Serious allergic reactions and increased risk of infections and liver problems may occur. Before treatment, your doctor should check you for infections and tuberculosis. Tell your doctor if you have an infection, flu-like symptoms, or if you need a vaccine. Explore what's possible. Ask your doctor about Tremfya today. Call 1-800-526-7736 to learn more or visit tremfyaradio.com.
1 iced coffee?
99 cents, please.
For real? No way. One iced coffee?
99 cents, please.
For real? No way. What a deal.
Your new morning groove. Iced coffee from McDonald's, any size for just 99 cents till 11 a.m. Price and participation may vary. Cannot be combined with any other offer. Ba-da-ba-ba-ba.
This segment discusses the sexual abuse of young girls and the lasting effects of that trauma. While we believe this is an important topic, it may not be suitable for some audiences. Last week, Dr. Frank Putnam explained the biological toll of childhood sexual abuse, and though his female growth and development study has proven these damaging effects, too many cases of abuse are still being dismissed in both the public and the courts. For years, Putnam has watched lawyers claim that a parent could never harm their child in this way. Another popular argument is that the victim is too young to be trusted to tell the truth. However, that's not what research shows to be true.
I think the statistics on that are, 0.5%, maybe as high as 2% of cases might have a fraudulent area, but, 98 plus are legitimate cases, and it's probably even higher than that. Generally, where I've been involved and seen a fraudulent case, there have been other motives that have been going on where typically teenagers are incentivized to lie about this to get somebody into trouble or to prevent something from happening. So it sort of haul it out, and generally you can figure that out pretty quickly. So I don't really worry. I mean, we've evaluated literally thousands and thousands and thousands of children. And really, it's a handful of cases where I could be sure that there was any kind of fraud.
It's this naive argument that allows many predators to get off with light charges or completely dodge accountability altogether. Putnam experienced this firsthand during his time working at the National Institutes of Health. He was tipped off that a Nobel Prize-winning coworker was trafficking young boys into America under the guise of adoption. Putnam first contacted the FBI, then tried to alert the NIH.
I went to my institution and basically said, we've got a child sex trafficking ring going on here. And they said, mind your own business. And now, ultimately, that person his name was Daniel Carlton Gajdusek, and he was a Nobel Prize winner, not in my institute, but in the Neurology Institute at the NIH. And he ultimately was convicted of one count, even though we know that there were probably 50 or 60 children involved, at least in the ring. He served a year in prison, in a very, very cushy prison, and then went to Europe, where he continued to be a scientist.
After dying in 2008, his biographer said Gajdusek never expressed remorse for abusing kids. Instead, he believed America's age of consent laws were prudish and that sex with minors was normal in the cultures he studied. The day before pleading guilty, the NIH let Gajdusek resign, allowing him to be eligible for his federal pension. During the investigation, a state's attorney reported that associates of Gajdusek tried to remove at least one accuser from the country before they could testify. Given that this is how victims have been treated when they come forward, Putnam says it's important to believe the ones who do. While every case needs to be investigated, the standard should be to assume that kids are telling the truth. especially given that it can be an incredibly hard decision for anyone experiencing abuse to speak up.
Our society has made it very painful to come forward. We see that over and over and over again. And anybody who's thinking about doing that, I think pretty much weighs that when they see what's happened to other people and what they've been threatened with. Often they've been threatened all their life. If you tell anybody, all these terrible things are going to happen to you. So they don't come forward lightly. And I think the vast, vast majority are telling the truth. Now, with little children, sometimes they don't know what exactly was done to them. I mean, they don't understand the anatomy. They don't understand all those sorts of things. They just understand that this is not right in some way, or this is uncomfortable.
But even for kids who may not fully understand the terrible acts that have happened to them, those experiences leave deep wounds. One surprising outcome Putnam notes is that many of these girls don't notice the signs of dangerous situations.
What we've seen is they're not as vigilant, and they tend to let things proceed farther than they really intend to, whereas the comparison girls and other things that we've done, we're much quicker to say, this is not going well, and to recognize when that things were not risky.
Putnam thinks it could be coming from a place of people-pleasing, but also recognizes that much of this reaction could be a product of dissociation.
They simply don't see the warning signs in the same way that the comparison girls did. And there are other studies where people read paragraphs and they say they're supposed to call it a halt if they see something in the sort of scheme of the paragraph that says this is not going the way you want it to go. And again, those studies again show that abused victims, particularly girls, let things go much farther before they're willing to say this is dangerous.
Along with being worse at recognizing signs of danger, the abused girls that Putnam has studied unknowingly put themselves in risky situations simply because of how they learned to behave around men. For some, being sexually aggressive is seen as a social icebreaker, which Putnam was able to observe in his research.
We had a scripted thing. The psychologist who was going to test him for a lot of other things didn't know whether this was a maltreated or a comparison girl. And we had a script where it was all videotaped and then basically scored by other people who were blind to whether this was an abuse or not. But what we saw was this much more aggressive move on the part of the maltreated girls to engage with this man.
Each girl was put in a corner of the room with the freedom to choose any activity they wanted while they waited for the male psychologist to finish up some work at his desk.
They could sit there and read, they could draw, but a lot of them were attracted to the male psychologist who was busy with a task, a standardized task. And what we saw was they would, sit on the table or want to sit on his lap or offer to give him a massage or things like that. And I mean, it was really quite shocking how forward they were in terms of their behaviors. And what we were able to code these behaviors into various categories and what we called coy behavior, in which the abused girls were exhibiting both a kind of stay away from me, but also come hither, a mixed message, so to speak, were the most characteristic of later sort of risky behaviors and both behaviors and also more aggression and more re-victimization and more other kinds of problems, so that they were emitting a behavior that was attracting, I think, predatory males in many ways. And that's partly how they ended up in relationships that were often exploitative.
Not because they want sexual attention, but because this is how their abuse has taught them to interact with men. And though Putnam's research has shown the mental and biological damage abuse causes, he says there are good treatment models for those who are able to access them.
A particular group called the National Child Traumatic Stress Network, which is government funded, has about 180 sites around the country, has been very good at pulling together what these treatments are and trying to train and disseminate them. But 180 sites doesn't move the national needle,
leaving countless kids to fend for themselves. Many develop behavioral issues that teachers and parents tend to focus on instead of recognizing it as a symptom of much deeper wounds. And without the knowledge and understanding of the underlying cause, these kids are often demonized for the coping strategies they've tried to patchwork together.
Most of the kids we see went through the foster care system. Many times they bounce out the last child I evaluated had 11 different placements in the foster care system. And the major reason was hypersexuality and aggression. And people just didn't feel safe having this really 9-year-old child in their home. And so they would turn around. And of course, you've now had ruptured attachment relationship after attachment relationship after attachment relationship. So these kids don't trust anybody. They don't believe in anything.
Putnam says that all too often, it's the behavioral issues that get all the attention, while the real problems are left to fester.
In fact, the real problem for that is that because you have movement from foster care to foster care to foster care often, the foster parents know very little about what's going on with the child medically. And they get this child, the child's on various medications, nobody knows why, they just keep doing the same thing. So there's been a woeful lack of really medical integration into the treatment of these children.
A broken system that doesn't address the root cause and at times reinforces the psychological wounds. Luckily, help doesn't always have to come from medical professionals. Putnam says moms can play a huge part in their child's recovery. The Female Growth and Development Study revealed that how well a mother was able to cope with finding out about their child's sexual abuse is a big factor in how well their daughter handles it. Kids who were believed and supported generally fared better than those who were doubted or blamed. Putnam's research has shown that supporting mothers through trauma, both their child's and their own, can be more helpful to their kids' development and healing than weekly therapy. But that's still defensive, something that helps only after abuse has happened. Through his work with a program called Every Child Succeeds, Putnam realized that targeting first-time mothers early in parenthood can greatly reduce the risk of abuse. These mothers were willing to make hard choices for the safety of their babies, even ones they weren't willing to make for themselves. Getting help to these women could break the generational cycle of abuse.
What we were very interested in was helping first-time moms who were, in most cases, themselves victims of at least terrible adversity at home. These were teenage moms. They had very little social support. Most of them had had no prenatal experience. And we found that really the best investment was to help the mom, and the mom could help the child. So we did a lot of working with the mom about child development, about really sometimes even simple things like how to hold your child the best way. I mean, often you saw the moms holding their child out like this, and like they were a sack of cement or something like that. It was so we found that working with the moms moves down to the children. And I'm very much a fan of what I call intergenerational interventions that work with sort of particularly mothers and children.
It's this type of information and advocacy that Putnam wishes to see ignite real progress in this field that's too often a blind spot in society.
I feel, and I believe, this is the single biggest sort of source of both mental health problems and also chronic illness in this country. And that's the biology piece of it, the accelerated aging in particular, and aging is the biggest risk factor for things like heart disease and stroke and cancer and the leading causes of death in this country. And that I wanted people to see this global picture, not just simply very frequently that single case study where they'd have an episode in which the person feels very devastated, but you don't really get a sense of how that ripples through their life.
Putnam's book, Old Before Their Time, is available now wherever books are sold. You can find more information about Dr. Frank Putnam and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our production manager is Jason Dickey. I'm Kristen Farrah.
For adults with Crohn's disease or ulcerative colitis symptoms, every choice matters. Tremfya offers self-injection or intravenous infusion from the start. Tremfya is administered as injections under the skin or infusions through a vein every 4 weeks, followed by injections under the skin every 4 or 8 weeks. If your doctor decides that you can self-inject Tremfya, proper training is required. Tremfya is a prescription medicine used to treat adults with moderately to severely active Crohn's disease and adults with moderately to severely active ulcerative colitis. Serious allergic reactions and increased risk of infections and liver problems may occur. Before treatment, your doctor should check you for infections and tuberculosis. Tell your doctor if you have an infection, flu-like symptoms, or if you need a vaccine. Explore what's possible. Ask your doctor about Tremfya today. Call 1-800-526-7736 to learn more or visit tremfyaradio.com.
One iced coffee?
99 cents, please.
For real? No way. One iced coffee?
99 cents, please.
For real? No way. What a deal.
Your new morning groove. Iced coffee from McDonald's, any size for just 99 cents till 11 a.m. Price and participation may vary. Cannot be combined with any other offer. Ba-da-ba-ba-ba.